In London, I'm Ollie Barrett. US President Barack Obama is welcoming President-elect Donald Trump to the White House for discussions on the transition of administrations. A senior Chinese official has been elected head of the global police cooperation agency Interpol for the first time. And a long-awaited reception centre for migrants has opened in northern Paris, close to the site where almost 4,000 people were camping on the street a week earlier.
It's 9:01.
KLEK LP Jonesboro, the voice of Arkansas Minority Advocacy Council. It's now time for Community Conversations, a program focusing on the people working to make the Jonesboro community a better place, while offering viewpoints from all sides of the issues. The views expressed in this program are those of the participants and do not necessarily reflect the views of KLEK 102.5 FM, the voice of Arkansas Minority Advocacy Council, or our underwriters or sponsors.
KLEK 102.5 FM. Good morning to you on your Thursday. It's November 10th, 2016. This is Community Conversations, a special extended version of Community Conversations. We're going to be here for the next 90 minutes, and we've got a plethora of guests that are going to be joining us today. First off, we have Mrs. Lindsey Stacy. That is correct, right?
Yes.
That is joining us from St. Bernard's, and they're going to talk about some of the programs that they are doing regarding issues of the heart. And from what I've been hearing off the air, it looks like they've been doing some great things to help people who suffer from various heart conditions. And then starting with our second segment, we will have Mr. Richard L. Hartness, Senior Author of The Circle, Coping with Integrated Life at Arkansas State. He also have Dr. Wilbert Gaines joining him. They're going to talk about the story of the first African-American faculty on the campus of Arkansas State University. So you definitely want to stay tuned the entire 90 minutes, but we're going to go ahead and start off with Mrs. Stacy. How are you doing today?
I'm doing great. How are you?
Doing good. All right, Quabila?
So thank you for joining us. I started receiving emails from Miss Rebecca Raspberry, and I was very interested in having you on to talk about the various things that are going on with St. Bernard's. You all have been making strides in innovations concerning healthcare. So I'm very excited to hear about this because I know people personally that suffer from various heart diseases. And so I'm sure there's so many more people that just doesn't talk about what they're going through. So I'm going to let you have it. We want to let people know that you are the STEMI coordinator for St. Bernard's. And I wanted to please explain that and then go into what STEMI is.
Okay, great. So I'm a registered nurse by trade.
Okay.
And STEMI coordinator, basically my job is just to make sure that everyone at St. Bernard's is got all the information they need to perform efficiently. So what is STEMI? STEMI is the worst severe heart attack that you can have. It's 100% blockage of one of your heart vessels. When that occurs, your heart is no longer receiving blood flow. So time is muscle, and I'm sure everyone's heard that. The quicker we can get you to our hospital and get you to our cath lab, the sooner we can open that vessel up and you can receive treatment. St. Bernard's is leading the pack when it comes to that area of the heart. We received the Go Plus Award from Mission Lifeline and American Heart Association.
That's wonderful.
And that basically means that we are the only state that is achieving the level that we need to get that patient from when they enter the door to the cath lab within 90 minutes.
Okay. So
it's a great honor that we can do that for the patients of Jonesboro and the surrounding areas.
Okay, so what does receiving these awards and recognitions mean overall for the hospital? Does it mean maybe drawing more physicians to the area? I don't know, more funding or something?
So, as far as what I can tell, what it does is it just brings awareness to our hospital that we are a great hospital for you to come to in this area and a surrounding area. There's lots of referral hospitals in the surrounding Jonesboro area that don't have cath labs. So if you're having a heart attack in those areas, you have to get to us.
Okay.
So just bringing awareness that our hospital is top notch, that we're doing the best STEMI care.
Okay.
In the area.
Now, Mrs. Stacy,
yeah.
St. Bernard's is planning a multi-million-dollar expansion, and if you ride by there, you already see construction going on. So how is the STEMI program going to tie into that new construction? Will that part of the hospital be upgraded as part of the plans to expand the hospital?
So we received that new beautiful cancer center, and there are multiple different areas that are going to be renovated, and heart care is one of those areas.
Okay.
So we for sure will be getting a new upgraded heart care department.
Okay. Now, we also talked about off air. There are two separate entities to the heart care facilities, I
Yes.
guess you say. There is the Heart and Vascular Clinic,
Yes.
which is located off of Church Street.
Uh-huh.
And then there's the Heart Care Center within the hospital itself.
Yes.
So can you talk about how they are different but possibly related?
So they're very much related. So the clinic is strictly where our physicians, our cardiologists,
Okay.
perform their clinic days. So every one of our cardiologists have a clinic day, and that's where they see their new patients and follow-up appointments.
Okay.
And then in the hospital, the heart care center within the hospital is actually where we perform our procedures. So we can do our coronary stents when you have a heart attack, or if you just are having issues and you want to have your coronaries looked at, we can perform an angiogram and look and see.
Okay.
So the hospital part of heart care is just strictly for us to be able to do procedures.
Okay. Now, you mentioned cath lab earlier.
Yes.
For those who may not know, and I'm still learning all of this terminology, can you please explain more what a cath lab is?
So a cath lab is actually a sterile procedure lab where a coronary stent or a heart stent, if you're having any blockages, can be placed. So it's similar to an OR, but it's less invasive.
Okay.
So it's not quite like the OR. It's under radiology, so you can see the coronaries outside the body on the screen,
Okay.
and it's just a way for our cardiologists to be able to visualize the inside of your heart.
Okay. And so, what are some other things that you do, particularly concerning being the coordinator? Do you do off-site education classes or seminars or things of that nature?
So yes, we actually have quarterly meetings that we invite all of our EMS agencies and referral hospitals to attend, where we discuss, the EKGs, which is the electrical picture of the heart, and challenging EKGs so that they can learn from those.
Okay.
I also I visit the referral hospitals on a regular basis
Okay.
and just update them with any new changes that our program has. So we are constantly evolving and improving our program. And part of my job is to make sure that everybody is aware and knows what the new updates are.
Okay. And I know that, St. Bernard's has also taken strides to expand not just the heart care center, but a variety of the other services. As we know that St. Bernard's has the medical mile
Yes.
down. Is it Matthews?
Yes.
And so there's so many things that St. Bernard's has to offer now. And it's helping to keep people in town. Really growing.
Mm-hmm.
We really do need a lot of those services right here instead of sending people off to Memphis, Little Rock, and
Exactly.
even further. So what do you see in the future for St. Bernard's? Or can you see that far?
Well, we are constantly changing and evolving to help provide the services for this area and the surrounding areas. I think the biggest change that I can foresee, especially in regards to STEMI, is just the knowledge of our STEMI program to the other referral hospitals, making it more efficient for them to get the patient and to be able to come to us quicker.
Okay.
Providing alternate ways such as air or ground transportation and things like that, just improving the swiftness of getting that patient to us in a timely manner.
And to touch upon that, do you think that there may be future plans to take Matthews and maybe widen it? Because I believe it's like certain stretches of it only like 3 lanes. You got the lane going one way and the lane going the other way and the turning lane. So I imagine as the hospital grows, there's going to be a need for probably a 4 or 5 lane road in front of St. Bernard's for ambulances, as well as people driving their cars that may need to get patients to the hospital quicker.
So it's amazing how those ambulances can get in a small area. They're a large vehicle, but they can get in a very tight area if need be. So, things are always changing, and it's always a great thing to be a part of an evolving department and a community for sure.
Okay, so start with this question. What are some other heart diseases that you all deal with, I guess, on a regular basis besides heart attacks? What are some other heart diseases that you maybe focus on, or?
So at St. Bernard's Cardiology, they cover every area of the heart that you can imagine, such as CHF, or if you have aortic stenosis, which is a part of your valve in your heart, AFib, which is an abnormal heart rhythm. All of these things tie into how well or how healthy your heart is. And our cardiologists are great at detecting these abnormalities and helping you come up with the best plan to treat those things. We have multiple programs, and I could be here for hours talking about all of them. My main focus is STEMI, and I'm starting to get more involved in the other programs, but STEMI and heart disease, when it comes to heart attack, is my primary focus, and that's where I want to make sure the community is aware of the signs and symptoms and what to do if you're experiencing those.
So let's go ahead and transition into that. So what are some of the signs and symptoms that people should be looking for?
So, the classic symptoms that you see on TV or the movies is when a person, puts their fist to their chest, and it's this...
Like Fred Sanford.
Yeah, like crushing pain, and then they're gripping their chest, and then they just, fall to the floor. That's the classic dramatic symptom. Not always do patients have those symptoms. Sometimes it's a more subtle, just discomfort or pressure, something different feeling in your chest. It could, tightness, pressure, heaviness, indigestion feeling. So that's some of the most typical symptoms. Anytime you have a pain or discomfort in your chest and it radiates to or moves to your arm, it can primarily the left arm. It can go to the right though, or up to your jawline. Back pain that starts in your chest and moves to your back. Anytime it's something that's just abnormal that you don't normally have, that's when you need to call 911. People are so scared to call 911, and that is the absolute best thing to do. Call 911. Get that ambulance there. They have the machine that can do that electrical picture of your heart, the EKG, and it will tell them instantly whether you're having a heart attack or not. And what that does is that they can call St. Bernard's right when they get that EKG, and they can have our cath lab there ready to go right when you arrive. So it saves so much time by calling 911 and getting that ambulance there.
That's definitely a valuable piece of information that the ambulance has that technology available. And I'm assuming you mean all of the companies around town, because there's several ambulance companies around town, but for them to be able to contact the hospital ahead of time and let them know, hey, get the lab ready, we're going to be bringing this person in, and they can immediately get to operating or whatever they have to do.
Exactly. All of our EMS services within our immediate Jonesboro area and surrounding areas have that machine. They can take that great communication technique that we have, and we've developed that and improved on that and made it easier for them to send those pictures to us so we can see quickly and say, yes, bring them on, let's go to the cath lab, let's get that going.
Now, are there someone who has suffered I don't want to say regular heart attack, that's for
someone who suffered a heart attack period.
A heart attack period, are they at a high risk of suffering from a STEMI, or how does it come about?
So typically when you have a heart attack, there's a medication that we would prescribe, our cardiologist would prescribe for you. If you take your medication the way you're supposed to, your risk of a future heart attack is less. Also going along with that, there's other things that you can do to not complicate your heart by not smoking, controlling your blood pressure, things of that nature. When you do those things, it reduces your chance of having a future heart attack.
We are speaking with Mrs. Lindsey Stacy. She's a registered nurse at St. Bernard's. She's talking about heart issues and STEMI. If you have a question just about anything related to the heart, you can give us a call at 870-277-1080. Once again, the phone number is 870-277-1080. We're also live streaming on Facebook. You can post your comments and questions on our live stream as well.
So do you have any upcoming seminars or events that the community needs to be aware of concerning discussion of STEMI or any other heart issues?
We are planning one in December. I don't know the exact date just yet. We're getting all the logistics down. December is a busy month, so we're trying to figure out the exact date. But we will have one in December for our EMS agencies and referral hospitals.
Okay.
Anytime a person in the community has any of these symptoms or just has questions, they can call our cardiology clinic or call our hotline.
Could you provide that information? If you all have it on
I can get that for you.
Okay. Well, we'll make a post on social media about that.
Yes.
Okay. So, what are some other things people need to be aware? What are some questions they can ask their doctors? If say they're at high risk of having a heart attack, if there's family history of heart disease, what are some things they need to be proactive about?
So if you have a family history of heart disease, the best thing you can do is see a cardiologist.
Okay.
Your PCP or your family doctor can do a lot of the tests, but your cardiologist is specialized in that area. So making sure that they know that you have a family history of heart disease or heart attack, letting them know any symptoms that you've been having so they have a clearer picture of exactly what's going on. If you've been having dizzy spells or if you've been having chest pain off and on for weeks but it goes away, that's important to tell your doctor. So make sure that if you're having any symptoms that you feel are just not right for your body, let your cardiologist know those things, because that can help piece the pieces together and make them have a clearer picture of what exactly is going on.
Okay. Now, we talked about how STEMI is basically 100% blockage of the arteries. Could the blockage start, or could there be circulation issues, say, in the lower part of the body that can affect the upper part?
So it all kind of goes together. Blockage is blockage, and it's all formed from plaque.
Okay.
So plaque is formed from smoking, not controlling your blood pressure. If you have diabetes, not controlling your diabetes, letting your blood sugar get too high or too low, and just being erratic.
Okay.
So not controlling your overall health, a healthy lifestyle, keeping your cholesterol under control. All of those things lead to plaque buildup, and plaque buildup can go to your legs. It can go to your heart. Plaque can build up anywhere.
Okay.
We normally find the plaque sooner and faster and more abruptly when it goes to the heart because it causes you a discomfort in your chest.
Okay.
We have a Facebook shout out, and this is from Joan Haynes Blockers. Says, great info about STEMI. So we got one listener that is enjoying the information that's being provided today.
Great.
And so, normally we think of, people with heart disease, they're over a certain age and, they're over a certain weight or there are other factors. So can you go into possibly what age or one, disease has no discrimination.
Exactly. Absolutely. It can affect any age, any population, female, male, it does not matter. It does not care. The biggest kickers are having a healthy lifestyle. Okay. When you have a healthy lifestyle, it reduces your chance of having a heart attack or heart disease in general. Females, we have hormones that protect us for a little while. Okay. When we don't have those hormones, it increases our chances of having heart disease and in the future. So females, typically it's the older female.
Okay.
Males, it can happen early on for them, especially if they have a family history of heart disease. So it varies. We've had patients that are young as 18 years old that have heart disease. Okay. And then we've had patients who are 95 and have been healthy their entire life and come in with a heart attack, and that is the only thing that is wrong.
Oh my goodness.
And it
sounds like my great grandmother. She was 100 when she passed and was in perfect health, and then one day but I think hers may have been more of a stroke issue, but still she lived to be 100. I think she did have to have a pacemaker put in, but other than that, no problems. Then one day, bam.
Heart disease it depends on if you have a history of it. If you have a history of it, you're probably going to be predisposed to that. If you don't have a history of that, have a healthy lifestyle, and that will greatly improve your chances of not having a heart attack or heart disease.
Okay, so say parents that have children. I know a case where the father has some serious heart disease. He has AFib and some other things going on. What is it when the blood flows in the opposite direction. Like something's wrong with one of the valves and the blood doesn't flow in the right direction.
So there's lots of issues when the blood is not flowing in the right direction. That's a little broader topic.
Okay.
Well, we only have about 70 seconds, so.
Bottom line, the question is,
yes,
he has a child. Should her mother be concerned that, somewhere down the line, she may develop some heart disease, and should she start getting tested?
Anytime there's a family history of an abnormality, I think it warrants you to let your family doctor know that, and that way, if they need to refer you to a cardiologist, that's the best way to do that.
Okay.
Like I said, the key point here is signs and symptoms: chest pain, discomfort that radiate. Call 911.
Okay.
Get that ambulance there quickly.
Thank you.
All right, Mrs. Stacy, well, we want to definitely thank you for stopping by the studio. As we get ready to close, is there anything else that you wanted to let the listeners know that we may not have covered?
The one thing that I just want to say is St. Bernard's is pleased to help anyone in the community. So any heart care problems that you may have, please come see us. We'd be more than happy to help y'all out.
Thank you. Thank you very much.
Thank you.
All right, don't go anywhere. Coming up after the break, we're going to have Mr. Richard L. Hartness Sr. and Dr. Wilbur Gaines talking about the Circle, the story of the first African-American faculty on the campus of Arkansas State University. You are listening to Community Conversations, and this is KLEK 102.5 FM.